So today we're going to take a look at your wrists and hands. Is that okay?
Yes, it is.
All right, so I'm just going to start by taking a look. Can I just have you place your hands in your lap? Excellent. I'm looking for any skin changes, any erythema, any rashes, any bruising, any lacerations. I'm looking for nodules. I'm looking for asymmetry. I'm looking for any signs of atrophy or deformities. And his hands look great. Can I have you turn them over, please? Excellent. Again, still inspecting for all of those things, also inspecting for muscle atrophy. And that looks very good as well. Now we're going to test your range of motion. Can I ask you to bring your wrists up like this? Excellent. So that's active range of motion. I'm going to see if I can passively get them a little further. Good. And then can I ask you to flex your wrist down? Okay. Perfect. And now placing your hands in your lap again, can I see you bend them to the side? Okay, very good. And then out to the other side. Good. Bring your hands over again. Let's test the range of motion of your fingers. So can I ask you to make a fist? Good. And then can I ask you to just make a loose fist? And I'm looking to see the finger alignment. All the fingers should point towards the scaphoid. Good. And now can I have you touch each finger to the tip of your thumb? Good. Excellent. Okay. So now we're going to test for strength and sensation. So again, can I have you bend your wrists up like this? And don't let me pull you down. Good. Testing the radial nerve. Good. Now you lift your thumb up like this. Also testing the radial nerve and the posterior interosseous nerve. Can I have you splay your fingers out like this? Don't let me squeeze them together. Hard as you can, hard as you can. Good, perfect. Testing the ulnar nerve. And then flex your hands down like this. Don't let me pull. Testing the median nerve. Good. Okay, can I have you take your hands over and rest them in your lap again? Now we're going to test your sensation. So I'm going to palpate along the median nerve distribution. Does that feel about the same on both sides?
Yes.
Does it feel normal?
Yes.
And about the same as up here?
Yes.
Good. Now we're going to check the ulnar distribution. Can you feel me on both sides?
Yes.
Great. Does it feel equal on both sides?
Yes.
And about the same as up here?
Yes.
Great. Can I have you turn your hands over? And now the radial distribution. So can you feel me here?
Yes.
Excellent. Does it feel the same on both sides?
Yes.
And about the same as up here?
Yes.
Excellent. And now we're going to do palpation. So I'm going to start with the distal wrist. And I'm going to palpate along the radius and the ulna. Tell me if you have any pain or discomfort as I do this. Palpating the ulnar and radial styluses. And then can I have you turn your hands over? And I'm going to start to palpate the carpal bones. Great. Any pain with that?
No.
Good. Now I'm just going to start palpating up all of the joints and the bones from proximal to distal. Okay, and tell me if you have any pain or discomfort.
No.
And I'm feeling for nodules, I'm feeling for crepitus, I'm feeling for step-off deformity, I'm feeling for enlargement of the joint. Everything good there?
Mm-hmm.
Everything okay there?
Yep.
Excellent. Good. And of course you would do the same with the other hand. Now that's a basic hand exam. There's some provocative maneuvers that you can check to look for specific pathologic conditions. So carpal tunnel syndrome, can I have you turn your hands over? The first provocative test is Tinel sign, and to do that I'm going to tap right over the course of the median nerve. And do you have any pain or tingling with that?
No.
Great. Any pain or tingling with this?
No.
Great. Next we'll check phalanx. Can I have you put your wrists together like this? And we're just going to hold this for about a minute. Okay, and then you would have them hold for a full 60 seconds and see if you get reproduction of the paresthesias, numbness, or pain along that median nerve distribution. Okay, you can bring your hands down. Thank you very much. Okay, next would be de Quervain's tenosynovitis. So with de Quervain's tenosynovitis, typically they'll be tender over the radial stylus. So right here, any pain or tenderness?
No.
And then the provocative maneuver is the Finkelstein's maneuver. So can I ask you to tuck your thumb into your fist? Good, and then cock the wrist down like that. Any pain with that?
No.
Excellent. Okay, you can relax everything. So now to check the ulnar nerve for any injury, First, we can check for cubital tunnel syndrome by palpating the ulnar groove, which is on the medial side of the posterior elbow, right there. Okay, the cubital tunnel runs right there. And if there's been repetitive irritation to the ulnar nerve, you could feel it a little bit thickened, and you may be able to reproduce pain and paresthesias when you palpate it. Okay, and then this finger between your thumb and index finger, and don't let me pull. And this is what you want to see. You want to see that mild flattening of the IP joint there. That's a normal test. Versus if there was an injury when I pulled, he would try to overcompensate like this. Okay, thank you very much. Next, to test for scapholunate instability, you would ask the patient to turn their hand over. You would have them ulnarly deviate the hand slightly, and then you would place your thumb over the scaphoid and apply a downward pressure as you use the back fingers to flex and radially deviate the hand. And you're feeling for a clunk or a grind to indicate that that scaphoid is not stable and it's moving out of the fossa when you push. And then last but not least, we're going to do a grind test to check for arthritis. So I'm going to axially load the thumb, and then I'm going to rotate. Any pain with that?
No.
Excellent. Thank you very much.